Understanding clinical trials. What follows is a consent form for a trial that is not being carried out right now, but for which you might be eligible if it were. Each page will include narration. Following the narration, please take all the time you would like to review the text and then proceed to the next page when you're ready. The title of the research study is Inhaled Insulin for the Treatment of Type 1 and Type 2 Diabetes Mellitus. The principal investigator is Dr. Christopher, and the sponsor is Zancorp. Why am I being invited to take part in a research study? You are being asked to participate because you have either Type 1 or Type 2 Diabetes Mellitus. What should I know about this research study? Your participation is entirely voluntary. You don't have to be in this research study. If you join the study, you can stop or leave at any time with no changes in the quality of the health care you receive. You'll be told about any new information or changes in the study that could affect your willingness to continue participation. You can ask all the questions you want before deciding if you want to be in this study. Why are we doing this research study? The purpose of this study is to test a new medication called IN605. We want to find out what effects, good or bad, it has on people with diabetes and compare these effects to a similar medication called Infrena. Neither IN605 nor Infrena are meant to replace any current treatment for your condition. These medications are meant to be added to standard medications used to treat diabetes. Both IN605 and Infrena are ultra-rapid-acting inhaled insulin administered with meals to improve glycemic control in adult diabetics. Both IN605 and Infrena have been shown to be effective in lowering blood sugar, known as A1C, with less likelihood of causing hypoglycemia than regular injectable insulin. However, IN605 has been altered somewhat so that it may be even more effective than Infrena in lowering blood sugar when administered with meals. Zancorp is the company that created and makes the experimental medication IN605 and other medications. IN605 has not been approved by the U.S. Food and Drug Administration, or FDA, for use in diabetes treatment. IN605 has been tested in animals, in healthy people, and in single doses in patients with diabetes. Infrena is approved by the FDA for treating type 1 and type 2 diabetes and is sometimes used in addition to standard medications for treatment of diabetes. How long will the research last? We expect that you'll be in this study for 5 weeks, requiring 5 outpatient visits. How many people will be studied? We expect about 40 people will be in this study at this site out of 240 people in the entire study nationally. Will I definitely receive the experimental medication? No. The decision to give you IN605, the experimental medication, or Infrena will be made by chance, like flipping a coin. You'll have a 50-50 chance of being given IN605 or Infrena. Neither you nor the study doctor will know which study medication you are getting. In an emergency, a doctor can find out which medication you are using by calling the on-call investigational pharmacist. What happens if I say yes, I want to be in this research? You'll have the following test to see if you meet the requirements for being in the research study. Prior to beginning the study, you will have an assessment of your medical history, including use of medications, a complete medical examination. We will check your temperature, blood pressure, heart rate, respiratory rate, and your weight, an electrocardiogram, ECG, a blood test to assess your hemoglobin A1C level, a pregnancy test. If you are a woman and can have children, your blood sample will be tested to see if you are pregnant. If you are pregnant, you may not take part in the study. You will have to be using a highly effective form of birth control to be in the study. A pulmonary function test. If you have asthma, COPD, or have smoked in the last 6 months, you may not take part in this study. If you meet study criteria, you will be randomized into one of the study groups. What happens during the study? You'll be asked to come for a study appointment once a week for 5 weeks. At your first appointment, you'll be taught how to use the inhaled insulin device and discuss how it will be used during the study. Using a small inhaler, much like the ones people with asthma use, you breathe a fine insulin powder into your lungs. From there, it enters your blood through tiny blood vessels. You'll be observed self-administering the inhaled insulin to be sure you are able to use the device correctly. You'll be given your study medication. You'll be asked to administer the study medication each day for 4 weeks before breakfast, lunch, and dinner. You'll be asked to keep a diary of your medication use, including study medication doses, any missed doses, and the meals you consume after administration. You will return each week to have your HbA1c level tested, to review your diary, and to discuss your experiences in administering the study medication and any side effects you may have experienced. Study staff will also be available between appointments if you have any questions or concerns you wish to discuss. What happens after the study? You'll come in for your final visit after the 4th week of study medication use. At your final appointment, we'll again check your temperature, blood pressure, heart rate, respiratory rate, and your weight, in addition to drawing blood to test your HbA1c level and asking you about your experiences and how you are feeling. If you decide to permanently discontinue treatment prior to the end of the study, you'll be asked to come in for a final appointment to return any unused medication and answer some questions about your experiences and how you have been feeling. After the entire study is finished, all the people taking part have finished the study, and all the effects of IN 605, both good and bad, have been compared to Infrena, we could tell you which study medication you took if you desire to know. Below is a schedule of study appointments and procedures. In the left-hand column, you'll see a list of all the procedures that you'll be asked to do during the trial. The top row lists all of the times you'll be contacted while in the study. A check mark tells you what procedures will happen at each visit. Please take all the time you would like to review it, and then advance when you're ready. What are the risks of being in this study? Risks of the experimental medication include the following side effects of IN 605, which have been most commonly reported: hypoglycemia, or low blood sugar, cough, throat pain, or irritation. Because IN 605 is inhaled and not injected, it may cause the serious side effect of bronchospasm, a spasm or tightening of the airways going into the lungs, which makes breathing more difficult. In patients with asthma or COPD, or chronic obstructive pulmonary disease, if you have asthma or COPD, you may not take part in this study. Severe allergic reaction is one of the serious side effects. Get medical help right away if you have any signs or symptoms of a severe allergic reaction, including a rash over your whole body, trouble breathing, a fast heartbeat, or sweating. Risks of the approved medications include the following side effects of Infrena, which have been most commonly reported. Hypoglycemia, low blood sugar, is one of the most common side effects of insulin, including Infrena. Cough, throat pain or irritation, headache. Because Infrena is inhaled and not injected, it may cause the serious side effect of bronchospasm, a spasm or tightening of the airways going into the lungs, which makes breathing more difficult in patients with asthma or COPD, or chronic obstructive pulmonary disease. If you have asthma or COPD, you may not take part in this study. Severe allergic reaction is one of the serious side effects. Get medical help right away if you have any signs or symptoms of a severe allergic reaction, including a rash over your whole body, trouble breathing, a fast heartbeat, or sweating. There are other potential risks of participating in the study. Risks associated with drawing your blood include redness, swelling, pain and discomfort, and bruising at the site of the needle stick. Some people may experience dizziness, lightheadedness, and/or fainting. The risks of electrocardiograms include skin irritation and a rash from wearing or removing the patches that stick to your skin or from the gel that is used with them. Your condition will be watched closely during the study. If you have any serious reactions or problems, the treatment will be changed or stopped to protect your health. What are my responsibilities if I take part in this research? If you take part in the research, it is important for your safety that you follow the directions of the study doctor and research staff. Tell your study doctor and staff about all medications you are taking now, prescription and over-the-counter, and any new medications that are prescribed to you. Do not use illegal drugs or incorrectly use prescription medications. Will being in this study help me in any way? You may not benefit directly from being in this research study if you are assigned to take the experimental medication and it doesn't prove to be effective. It's hoped that IN 605 will lower blood sugar more effectively and with fewer side effects than Infrena when administered with meals, but we cannot promise that this will happen. However, the results of the study may help others in the future. Will being in this study cost me any money? There will be no additional cost to you from being in this research study. The medication, clinic visits, and tests that are done for research purposes will be free. Any cost for the standard treatment of your condition will be billed to you or your health insurance. What happens to information about me? We'll try to limit access to your personal information, including research study and medical records, to people who have a need to review this information. We cannot promise complete privacy. The University of Massachusetts Medical School Institutional Review Board, i.e. the committee that reviews, approves, and monitors research on human subjects, and other representatives of UMass may need to review your records. As a result, they may see your name, but they are required not to reveal your identity to others. The study sponsor, Zancorp, and/or their representatives, and the U.S. FDA may inspect your medical records that pertain to this research study. Your identity will remain confidential in any study results that are made public. What happens if I'm injured because I took part in this research? If you're injured while in the study, seek treatment and contact the study doctor as soon as you're able. If you're injured or have any harmful effects as a direct result of the administration of IN 605 or Infrena, or any procedure required by the research, necessary medical treatment will be made available to you at UMass Memorial Medical Center. The sponsor, Zancorp, will pay the reasonable and necessary medical costs for study-related injury that isn't eligible for billing to your medical insurance. To pay these medical expenses for a research injury, the sponsor will need certain information about you, such as your name, date of birth, and social security number. This is because the sponsor has to check to see if you receive Medicare. If you do, the sponsor must report the payment it makes to Medicare. The sponsor cannot use your information for any other purpose. The sponsor has no plans to pay for medical expenses for injuries that are not directly related to your research participation or that are caused by the natural course of your disease. The sponsor has no funds set aside for any other form of compensation in the event of a research injury. You do not give up any of your legal rights by agreeing to enroll in this study. Will I be given any money or other compensation for being in this study? You'll be reimbursed for your time, travel, and other expenses associated with this research study. You'll be paid $50 at each clinic visit. If you complete all study procedures, you'll be reimbursed a total of $250. In order for us to pay you, you may need to give us private information like your home address or social security number. In addition, free parking for all scheduled visits will be provided to you during the study. Zancorp will be the owner of the study data. Zancorp plans to use the results and make it patents or sell the medication in the future or make profits in other ways. You won't be paid for any part of this. What are my other options? You don't have to be in this study. Instead of being in this research, you may continue to get regular care from your doctor, which may include being prescribed the FDA-approved medication in this study. If you decide not to be in the research now or later, it won't affect your usual care and it won't be held against you. Talk with your doctor about your choices. What happens if I say yes, but I change my mind later? You're free to leave the study at any time. There are no penalties and you don't lose any benefits to which you're otherwise already entitled. If you decide to permanently discontinue treatment prior to the end of the study, you will be asked to come in for a final appointment to return any unused medication and answer some questions about your experiences and how you have been feeling. If you leave the study and don't agree to provide more information, then no more information about you will be collected. Data that we have already will stay in the study database and cannot be removed to maintain the integrity of the research. However, you can ask us to destroy any information that identifies you so that no one knows that the data came from you. Our contact information is below. Can I be removed from the research without my permission? The person in charge of the research study or the sponsor can take you out of the study even if you do not want to leave. This may happen if the investigator decides that continuing in the study would be harmful to you, you need treatment not allowed in this study, you fail to keep your appointments or take the medications as instructed, you become pregnant, or the study is canceled by the company making the medication, Xancorp, the FDA, or the UMass Institutional Review Board. Who can I talk to? If you have questions, concerns, or complaints, or think the research has hurt you, you can talk to the research team at this number, or contact someone from the UMass Institutional Review Board at the phone number or email listed here. Thank you for taking the time to review this presentation. Please click here to complete a brief survey.